To ABC News.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES. At Radiosurgery New York, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
You know, I miss my father so. My father, Chester, a year and a half ago, he passed to the hereafter. But I'll never forget, in 1991, my entire family was perplexed because my father had some kind of a fungus and a growth going on in his stomach. We had gone to all kinds of specialists. They didn't know what to do. And then we went to Dr. Gil Lederman, who was New York's only triple board certified Harvard-trained radiation oncologist who first brought non-invasive stereotactic body radiosurgery to America. That was not his specialty, but he was good enough, kind enough to take a moment and do a referral to an Egyptian-American surgeon that he knew was a specialist in this area. Hours of surgery, and my dad's life was saved. Because of the referral, because of the interest that Dr. Lederman took in that case, as he has hundreds of other cases. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, and hospitalization. Dr. Lederman treats newly diagnosed and recurrent cancers anywhere in the body, even if prior chemo, and this is important, if prior chemo, surgery, or radiation didn't work, then on the rebound, you need to get some consultation from Dr. Gil Lederman. He's a brain and prostate cancer as well as body cancer expert, breast, lung, pancreas, liver, kidney, and more. To hit the cancer, call Dr. Lederman at 212-CHOICES. That's 212-CHOICES. He'll speak with you, send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his super convenient location off of 38th and Broadway in Manhattan. He takes most insurances, Medicare, Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. That's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. It's early and cold. We hope you're staying warm. We hope your pipes are working. And stay tuned with us for the next hour. We're going to talk about patients, news, how to make your life better, safer, longer, healthier. I'm Dr. Gil Lederman. I'm a board-certified, triple board-certified oncologist, cancer doctor. We're at a private cancer center called Radiosurgery New York, which means our boss is you. We don't work for the hospital. We work for you. Our boss is you. We do our best for you. We're located on 38th and Broadway, 1384 Broadway, and these are answers to questions that people commonly ask us. We have a spacious new cancer center. We have operating rooms, CAT scan. We actually have our linear accelerator there. So we're very convenient. We're not only super convenient, I think we're a little bit super. We take most insurances, Medicare, Medicaid. When you walk in, we know who you are. You know who we are. There's not miles of cold corridors and locked doors and strange faces and people telling you no. There's people telling you good morning or good afternoon. How can we help you? How can we take care of you? How can we make your life better? We have a number, 212-CHOICES, 212-CHOICES, which reflects how we believe you should have choices in your life. Many cancers and many treatments, there are choices. And you'll see from the discussion today that often the choices will give you better results, trying to avoid cutting, bleeding, surgery, chemo. And you can speak directly with our triple board certified doctor, not machines, not students, not interns, not residents, not the secretary. You can speak with the doctor and get answers, not confusion, answers. So we have a booklet and DVD. We have 3 separate booklets, actually. One's about tumors in the brain, benign and malignant tumors. And we have a big specialty in brain cancers and brain tumors, meningiomas, acoustic neuromas, pituitary tumors, metastasis, glioblastomas. We were the first in New York to provide and actually bring this technology, brain radiosurgery, which is a non-invasive technology. Why is it so beautiful? Because many places treat the healthy brain or treat the healthy body to get to the cancer. And we believe that God wanted your body alone. We want to hit the cancer. We want to get rid of the cancer, but we want to leave your body alone. And that's what radiosurgery is about. And because we focus the beam on the cancer area, we can often increase the intensity of the beam, which means that biologically it's more effective. There's fewer treatments. It's more convenient. So that's what radiosurgery is all about, to try to hit the cancer or hit the tumor and avoid harm to the healthy tissues. And I often talk about it. Willie Sutton was arrested. He was a bank robber. And the police asked him, "Why do you rob banks?" And he said, "That's where the money is." Well, why do we hit cancer? Why do we focus on the cancer? Well, that's where the problem is. The problem isn't with the healthy tissues. So we believe that it's logical. And when you come in, we'll show you data and facts. And we have 20,000 patients that we've treated. And we follow the patients. We have data managers, and we update the data, and we give presentations around the world at medical meetings. So it's more than super convenient. We think it's really super. We're close to all the trains, buses, subways, Grand Central, Penn Station, PATH trains, Port Authority. We have something called the Urgent Cancer Consultants, where actually we guarantee that we'll see you within 1 business day, so you don't have to wait weeks and months. We don't think it's fair for people who are in pain or suffering to have to wait weeks and months. So just call us at that number, 212-CHOICES, which is 212-246-4237, 212-246-4237. We want you to have the most choices by calling us at 212-CHOICES. And again, we take most insurances, Medicare, Medicaid. So we start out with some good news today. We have a gentleman with stage 4 cancer, and people often call me and say, "Dr. Lederman, do you treat stage 4 cancer?" And the answer is yes. Why do we do that? Well, we do it because, number one, often the other treatments like surgery, well, surgery can't really help stage 4 cancer very much. It can treat a particular area. But stage 4 cancer means the cancer's traveled. It's gone from the original site and got in the lymph system or in the blood system and traveled to other sites. Well, in this case, the case I want to talk about is a man with cholangiocarcinoma, which is a cancer of the biliary ducts, and he had stage 4 cancer and was in terrible pain. He was in another hospital, a hospital in New York City. He's Jehovah's Witness. He wouldn't take surgery because it wouldn't take blood. In fact, surgery wasn't very useful for him. He was in terrible pain on narcotics, and he came to us with stage 4 cancer in pain last year, and he heard what we talked about. He trusted us. He went through treatment, and he just came in this week. I saw him Monday morning, and guess what? We staged him up again, which is what we do. We have a report card. You get a report card. We get a report card. How did the treatment go? Because treatment without a report card doesn't really help very much. Obviously, we want good results, but we want you to know, and we want to know the results of the treatment. So you come to us, and you get the DVD, and you get the report in your hand, and you get to read it and study it and show it to your friends and family if you wish. And this gentleman came months after being treated with radiosurgery for metastatic stage 4 cholangiocarcinoma, and guess what? He's in complete remission. All the cancer has been successfully treated. There's no active sites. Cancer's shrinking or going away or gone. Nothing new. He's doing great. He's feeling better, breathing better, doing better. It's Jehovah's Witness. With us, there's no cutting, no bleeding, no blood transfusions. He is happy. He's doing great. And that's what it's really all about, to try to get the patient in good shape and to avoid all the harmful things that we'll talk about later in the hour. So, I want to talk about another patient, and a similar patient, actually. This gentleman came in this week. He heard about us. He's a businessman from New Jersey. He's 77 years old. He's married with 2 kids, and he has a history of cancer in remission, prostate treated years ago, and now has metastatic stage 4 adenocarcinoma of the lung. Now, he quit smoking 45 years ago, but he has, you can see already, I told you he had bladder cancer and now lung cancer, so those are both smoking related. He's quit years ago. Unfortunately, he's still got the lung cancer and probably was around a lot of smoking in his lifetime in the construction industry. He was going for surgery on his back about a year ago, and a chest x-ray was done which showed an abnormality. That was biopsied and showed to be adenocarcinoma. So he tried to have surgery. Unfortunately, the cancer was in the right and left lung, and surgery wouldn't work because of the findings at surgery. So they opened him and closed him. Didn't help, that surgery. He fortunately did recover. And then he started on chemotherapy. He's had chemo to 2013 until January 2014, and he just couldn't take it anymore. So one thing we talk about is why think about us. Well, number one, you want to get better results. Number two, you want not to have the systemic effects of chemotherapy. Well, this man didn't want the systemic effects. He came to us. He hadn't been properly staged. We properly staged him and showed him, in fact, not only did he not tolerate the chemo, but it wasn't even working. So if it wasn't working and he wasn't tolerating it, there surely wasn't a reason to take it, right? So he came to us, and in one day we got him staged. We made a stereotactic frame of his body, which is totally painless, non-invasive. We computerized everything in his body that we could. And yesterday, he started his treatment. And he was happy. He's already feeling better. He got rid of the chemo from his body. He knows where the cancer is. Finally, he knows where it is. He's got the report in his hand. He's got discs, and he's going through effective treatment that we believe most likely will stop or shrink the cancer that we're focused on. So he's planning to travel and live his life again, finally getting away from chemo, and happy with the treatment. And that's what it's all about. Happy with the treatment and have effective treatment. So he will have his report card in about 90 days or less. We will take care of him, and most probably what we hit, about 90% chance, will stop or shrink or go away where we hit it without any cutting, bleeding, or chemo. So at that point, we're going to stop and hear from the man with the golden voice. By the way, we're live. We're live at the WABC studios, and our number is 1-800-848-9222. Again, just give us